In 2019, a global study was conducted involving women from 40 countries around the world. And can you imagine? 71% of women said they were dissatisfied with their breasts. And indeed, unfortunately, after the age of 40, women face the fact that their breasts lose firmness, lose elasticity and fullness, and they start to sag. And when women see themselves in the mirror, of course, they experience unpleasant feelings and don't like what they see. So, in this video, I want to tell you about the most unexpected reasons why this happens, and how you can slow down this process, even restore the shape of your breasts, and visually increase their volume. Dear ladies, this topic is actually very important, and I'd like to ask you to like this video and subscribe, because it helps the video get promoted on YouTube so that as many women as possible can learn this useful information and help themselves. The first important, and for many, not so obvious reason why breasts sag is a disruption in the body's biomechanics, specifically slouching or even hyperkyphosis of the thoracic spine. And many people don't even realize how negatively this affects the breasts, because there are scientific studies that have proven that changes in body posture and slouching cause the breasts to stretch out more quickly. Look, here are two mammary glands. If your chest is open and upright, the mammary glands rest on the pectoral muscle and the chest fascia. In other words, the pectoral muscles kind of support and lift them. But if your shoulders start to roll forward, do you see what happens? If your sternum starts to sink in, and if your diaphragm is also in spasm, then the mammary glands end up hanging more on the ligaments, and under the force of gravity, the mammary glands start to stretch out faster. After 40, especially when your hormonal balance changes, collagen starts to regenerate and recover less effectively. And there are these Cooper's ligaments, which are basically made of collagen too. These ligaments gradually start to stretch, and you might notice that as you age, your breasts were here, then here, and here, they start to sag. And from this reason comes a second, less obvious cause, which is related to lymphostasis. If we don't go to extremes, like surgical operations, even an ordinary woman who has posture problems, who constantly has chronic tension in her chest, diaphragm, or abdomen, this leads to all these tissues becoming very tense. Wherever there is tension, swelling always forms. So it turns out that the first cause actually intensifies the second cause. Lymphostasis leads to fluid, under the influence of gravity, stretching the connective tissue and the skin of the breast. The third reason is related to the habits of breastfeeding women. Many women notice that after childbirth and breastfeeding, their breasts lose firmness. In women, the glandular tissue in the breast begins to increase, meaning there is more of it, and it starts producing milk. The breasts can increase by 1 or 2 sizes. Never abruptly stop breastfeeding. All of this leads to stretching. This has been scientifically proven. A negative factor, of course, is age. The older you get, the less adaptive collagen and connective tissue become, and under stress, they stretch more easily. And the regeneration of collagen itself is worse, right? If we can't influence age, we can definitely influence our lifestyle. A healthy lifestyle gives collagen the chance. And of course, age also plays a role, even if it gets overstretched, to return to its original state. Be sure to use special underwear that will support the shape, so there isn't any overload, especially gravitational overload. Be sure to work on your chest, your pectoral muscles, and your diaphragm. Do breathing exercises, because all of this will speed up blood circulation and lymph flow from this area, helping your breasts stay healthy for many years. The fourth, less obvious factor is trauma to the mammary gland, especially when you play sports. If you run or jump, always do it in a special sports bra that provides support, because if your breasts are constantly bouncing, it will also overload Cooper's ligaments, causing them to stretch out faster. This is especially true if this jarring is combined with poor posture and chronic swelling in this area. So in that case, it will be a triple blow to your mammary glands. A bra should only be worn for a limited time. You don't need to wear it 24/7. Because if you use a tight bra with stiff underwires, it can also disrupt lymphatic flow and cause lymphostasis. So use all of this wisely. Only use it during sports and physical activity. And the last factor is, never lose or gain weight abruptly. Any weight fluctuations will also lead to stretching of the breasts. And now I'll give you the most important basic techniques that will improve the shape of your breasts and even make them look bigger visually. Although, of course, there are many important techniques, and you need to follow a whole protocol. If you're interested, just go to my channel. So, the first exercise that every girl should do is to work on the chest muscles. The muscle acts like a pump. It stimulates lymphatic drainage, because this muscle right here, see? And here, in green, you can see the lymphatic vessels. They pass through this muscle. When this muscle is constantly contracting, the fluid, excess fluid, starts to drain away. But there's another extreme. If this chest muscle starts to shorten and spasm, it will also lead to increased lymphatic stagnation. So, first of all, you need to add push-ups or any exercises that work your chest muscles into your daily routine. And after that, you absolutely must stretch this muscle. In other words, once it has worked and improved blood flow in this area, you then need to stretch it. What can you do? The most basic and simple thing is to just stand in a doorway. Place your hands like this and start stretching your chest. And you'll feel your chest muscles start to stretch here. You can put your hands in this position. You can also place your hands like this, at about a 45-degree angle, to engage your minor chest muscles as well. So, you work out these muscles and then stretch them. After that, it's important to also work with the chest fascia. Especially if you notice that you have a slouch and your shoulders are rolled forward. Then besides working on the muscles, you also need to work on the chest fascia. If you feel any discomfort or pain, it's a sure sign that your chest fascia is tense. From the sternum, you move to the side, and here are the intercostal spaces. I place my fingers right on these intercostal spaces, and I start turning left and right, as if beginning to stretch the chest fascia to the sides with my fingers. So you take it and stretch like this, turning your rib cage to the left and right. You start stretching the chest fascia to the side like this. It feels really nice. Breathe and just make these turns, as if stretching all the tissues from the sternum. Please write in the comments how you feel when you do the technique on the chest fascia. Do you feel warmth, a sense of your chest opening out, heat? We've worked here with the chest fascia. And here we grab the muscle, and there's also the chest fascia there, right? We grab, well, everyone grabs this part here, right? And I start. Just put my hand like this and simply start kneading. Just make circular motions like this. These are very pleasant movements. So here you have the mammary gland, and here you've grabbed the muscle. And we start stretching, right? We make these circular movements and try to make it so the amplitude of the movement increases, so the range of motion gets bigger, especially upwards. Try to pull the tissue upward and outwards so that the shoulder opens up and the fascia gets pulled up. So, have you worked with it? Next, you can place your hand under the breast, grab the tissue, and make these circular movements with your torso. Look, I'm just rotating my torso and lifting as I go. So there's a constant upward vector. That is, by arching the tissue, you're pulling upward, and all the tissues and fascia below start to stretch. If you've had your breasts examined and everything is fine, then I definitely recommend doing breast massage. A woman should monitor her breasts and regularly perform a palpation exam of the breast. Stand in front of a mirror and first look at the symmetry of your breasts. You look while your arms are down, then raise your arms up and also observe what happens to your breasts. In other words, normally they should be symmetrical and elastic. Next, you begin the examination, What can you do? Take 3 fingers, your index, middle, and ring fingers, and place them on the nipple or next to it. Make circular motions, that is, starting from the nipple, from the center to the periphery, and examine the entire breast in this way with circular movements. So, if you suddenly find any lumps or something that worries you, you should not massage the breasts. You can work with the fascia and go see a doctor. That's the most you should do. You take the breast and start massaging it in the same circular motions as you did during the examination, only more intensely, supporting the breast as you need it. You simply take it and knead it with your fingers, and you'll notice that as you make these circular motions, kneading and kneading like this, it will become lighter, more relaxed, and softer. And after that, you can even squeeze it like this, right? Bring it to the point of resistance and give it a gentle shake, that is, a light vibration. Then you'll feel that the pressure has gone away because the fluid is leaving. You press a little more and do another gentle vibration. And this is the essential minimum that every woman should do. If you want to approach this even more thoughtfully and professionally, then you can't do without working with the body's diaphragms, working with the deep myofascial line, and even addressing the psycho-emotional tensions and blockages that exist in the chest area. So if you're able to do this routine, I strongly recommend that you keep developing your skills, study your body, and dive deeper into the topic. So be sure to subscribe to my channel. That's all from me for now, dear ladies. Take care of your health, always check your mammary glands, and work with them. I'll see you in the next episodes. Bye.